Every parent wants to see their child talk, walk, develop, and live normally, like, of course, like a normal child would want to live. But then again, it's also heartbreaking as a parent to realize that your child is not meeting the required milestone, and then you begin to wonder what might be going on. Which is why today on the show, we want to talk about developmental delays in children. Last week, we talked about autism spectrum disorder, and this week, we want to talk about something maybe not really related, but something in line with development. Good evening, and thank you for joining me. My name is Doris Mayum Shishe. This is Gyna Plus, a show that talks about health issues that affect women, girls, and children in the society. And of course, after the break, you will meet my guest. Please stay tuned. Thank you for staying tuned. This is Gyna Plus, where we discuss health issues that affect women, girls, and children in the society. And of course, the show comes up every Wednesday at 6 p.m. And we have an active YouTube channel, Afia Culture and Lifestyle. We have all of this information there. You could go take a look and, of course, learn more. And before the break, I mentioned I'll be looking at developmental delays in children. A lot of us may have seen different issues. Baby who is 2 is not acting 2. It could be speech delay, different kind of delays. But of course, it's not on me to tell you all of that information. Last week we had Dr. Ngozi Onu, and thankfully we're honored to have her back again. Dr. Ngozi Onu is a pediatric neurologist in Enugu State University Teaching Hospital. It's good to have you again, Dr. Ngozi.
Good to be
Welcome.
with you, Doris. Thank you.
Yeah, so last week we spent time talking about autism spectrum disorder, and I'm like, okay, because there's more that you should talk. It's not easy to have you one time and then just let you go. Yeah. It's important that we use the time very wisely. So thank you again for coming back. But when we talk about developmental delays in children, what is it that really constitutes a delay?
Okay. A child is said to have developmental delay when this child is not meeting the expected milestones for the child's age after you've adjusted for the normal variations, okay? Because we don't all achieve milestone at the same age. There's a variation that is said to be normal. So you've exceeded that normal limit of the variation, and this child has still not achieved the milestone. That is a delay. So this delay, we look at them in 4 domains, okay? We look at them in the gross motor domain. Is the child able to hold the head? That is the first one that happens in gross motor. Is the child able to hold the head? Is the child able to sit down? Is the child able to roll over? Is the child able to crawl? Is the child able to walk? Okay, follows that progression. Okay, at 2-3 months, the child should be able to hold the head. If after 4 months, this child is still not able to carry the head, like when you carry the baby up, the head doesn't wobble side to side like a newborn baby, is a problem. That is a delay.
That's at 4 months.
Yes, at 4 months. The child should seek help, and the parent should seek help for that child immediately. Okay? At 6 months, the child should be able to sit. If at 9 months, the child is not sitting with pillow, not sitting and keeping the hands, no, sitting upright and leaving the hands free, okay, that child is delayed, and the parent should seek help. Okay, crawling, neither here nor there, but typically children crawl between 6 to 9 months, okay, but some children don't crawl and they get on to walk. Then for walking, if a child is not walking by 18 months.
That's 1 year, 6 months.
Yes, 1 year, 6 months, the child is delayed. So that is for the first domain, the gross motor domain. Mm-hmm. So we have the fine motor domains that have to do with the fine movements of the fingers. Okay, between 0 to 3 months, the child should be able to open and close the hands, just open and close, open and close. But if you see the child is always fisting the hand, at 3 months, the child cannot open and close. Is a problem. At 4 to 6 months, the child should be able to grab a toy, just grabs it like this, hold it with 2 hands. Okay, if at 6 months the child is not able to grasp, is a problem. Okay, at around 8 to 9 months, the child should be able to transfer objects, pick up the toy, put it here, transfer it from one hand to the other. Okay, then around 9, 10, 11 months, just towards 1 year, this child should have a pincer grips, like be able to pick up finger food and eat. Should be able to pick up something and put in the mouth and eat. If at 12 months this child doesn't have a pincer grasp, is a problem. Okay, between 12 and 18 months, 1 year to 1 year, 6 months, this child should be able to scribble, That is when your walls become dirty.
Oh,
Okay, the
yeah.
children picks up crayon and starts drawing rubbish on your wall. The child should be able to stack 2 blocks, bring 2 building blocks, stack them to themselves. If the child is not doing that at 18 months, it constitutes a delay in the fine motor domain. Okay, we have delays in the speech and language domain. Around 3 months, the child coos. Just hear the child, ooh, just making some funny sounds. 4 to 6 months, the child starts babbling, baba, dada, tata. If at 9 months the child is not babbling, it constitutes a delay. Okay, at 1 year, this child should have some words, at least 2 words. Okay, at 18 months, the child should have between 5 and 50 words. This child doesn't have any words at 18 months, is a delay. At 2 years, this child should have up to 100-word vocabulary, should be able to use 2-word sentence, beat me, give me, come here, drink water. Okay, at 3 years, this child should have a 3-word, should be able to make a 3-word sentence, and should start using past tense like where, what. Okay, use some pronouns, boys, girls, my books. Okay, and should have a vocabulary that's up to 300 words. At 4 to 5 months, this child should be able to tell you a story, use up to 5 words in a sentence, should be able to tell you a story. If the child is not meeting these milestones per age, there's delay in the speech and language. Okay, the next domain is the social domain or adaptive domain. Okay, where a child should be able to smile back at the parent. No, I know you're smiling at me, I'm smiling back. I see you, mommy, I'm smiling back at you. Between 2 and 3 months. At 3 months, 4 months, this child is not smiling back, there's a problem. Okay, this child should be able to communicate with you with the eyes. Okay, from 6 months, should be able to look at you. From 9 months, should be able to listen and turn towards you when you call the child's name. If the child is not meeting these milestones, there's a problem. So when should a parent seek help? Okay, we've passed the upper limit that is expected for that particular milestone, and the child has still not achieved the milestone. Seek help. In a particular domain, let's say gross motor domain, the child is having so many delays in that particular domain. Seek help. The child is having delays in multiple domains. Seek help. There's no need waiting and saying this child is going to outgrow it. The child may never outgrow it without intervention. So it's good to seek help early enough so that we can know how to help the child and also help the parents.
Wow. I mean, thank you for that, the detailed explanation. But then again, are there factors responsible for all of these delays? Is this something that is the child is born with? Is it the environment? What really constitutes, what really causes this delay rather?
Okay, a whole lot of things can cause the delay. The child can be born with issues that will give delay. The child can also acquire issues that will give delay. Okay, so I would like to break down the causes. Okay, we have the medical causes. Okay, a child who had challenges at birth, what we call perinatal asphyxia, the child didn't have the first cry, did not initiate breathing at birth, maybe stayed for some time without breathing, and the child has what we call asphyxia. The child is more likely to come down with delays later in life. If a child is born before time, born preterm, okay, the child is more likely to have delays. Okay, maybe the child was born, okay, everything was fine, and the child had a severe infection, particularly meningitis, in the first 1 year that wasn't properly treated, okay, or treatment wasn't started early. It can actually make the child to lose all the milestones the child has acquired, and then the child becomes delayed. Okay, then we also have some genetic issues, like children who have Down syndrome, they are more likely to have delays. Children who have Fragile X syndrome, they are more likely to have delays. These are for the medical causes. Even jaundice, I forgot to mention that. Children who have severe jaundice that got into their brain, okay, is a known cause. It's actually a common cause of delays in our environment. Okay, then apart from the medical causes, we also have the environmental causes. Okay, talking about the environment, malnutrition. A child who is not well nourished will not have the nutrients to develop, does not have the nutrients to grow, does not have the nutrients to develop. A child who is born in poverty, a child who is neglected, the parents are too busy or the parents don't really know, okay, this may cause the child to be delayed, especially in the aspect of speech and language and then social and adaptive domain, may cause some delays there. We also have psychosocial issues. A child who is born to a mother who has some depression, okay, this mother is not able to care for this child. Okay, a child who is born in a family that the dynamics is not steady. Okay, this actually can cause some delays in children. So these are some of the causes of delays.
Okay. So I like that I'm learning on the show. But before we take this break, sometimes I would, you know, why we talked about last week when you talked about autism, I asked about medications during pregnancy, routine medications, and all of that. Does that have any role to? Does it have anything to do with a child, you know, coming down with any form of developmental delay?
Yes, it does.
Okay.
It does. Okay, particularly folic acid and then iron. Okay. Folic acid in the first 3 months of pregnancy, it's actually advised that a woman who wants to get pregnant should start taking folic acid. Okay, so when the woman has some deficiency in folic acid in the first 3 months, it can actually affect the development of the nervous system. Okay, giving us some neural tube defects that will cause these delays. Okay, sometimes you see children who are born with their head being very big. You see children who are born with a mass at their back. Okay, some part of their spinal cord is not covered by bone, it's coming out.
Okay, that's because of
folate deficiency in the mother. It causes that. So not taking the routine antenatal drugs, okay, is going to give delays. Okay, a mother who doesn't take her iron supplement, iron helps to build the blood, and blood helps to carry oxygen to the brain and to everywhere. So when the mother doesn't take her iron supplement and she has anemia, if she's anemic and she has a baby in utero, it can actually affect the development of the baby's brain. Okay, so not taking supplements during pregnancy can actually cause delays.
Wow, thank you so much for putting it out there. So if you're a mom or a potential mom, for instance, I think this particular one concerns you a lot. So if you've gotten to a point where you're getting ready for pregnancy, it's advised that you begin your, you know, folic acid medication.
Folic acid, make sure you treat every infection that you have. Even when you're pregnant, if you have diabetes, if you have hypertension, make sure it's well controlled, because these are before and during the pregnancy.
All right, thank you so much. We'll take a break now, and after that, we will get to talk more about developmental delays in children. Please stay tuned. Thank you for staying tuned. Yes, this is still Gyna Plus on Afia television, and it's been quite a moment for me. Like, I've been learning back to back. My guest in the studio has been talking about developmental delays in children, and it's been quite an eye-opening session for me. So, Doc, I mean, you've talked about quite a number of factors, and for me, like I said before, it's like one of my wow moments. Wow, okay. So, thank you for that information. So, now there's another concern I'd like you to address. Sometimes parents tend to relax a bit. A neighbor can simply tell you, my child was 2 and they experienced it, they agree, they think they're better now. So I'd like you to even differentiate between that delay and then the late bloomer that people often talk about. Well, what is the difference?
Okay, a true neurodevelopmental delay and late blooming. Some children just naturally may actually not achieve the milestone at the age they are supposed to achieve it. Okay, and it's still normal for them. Okay, some children may, just a very few subsets. Okay, but the difference between that and those that have a true delay is that you find out that their own delay, the late bloomers, is only in one domain.
Okay,
maybe they didn't work on time, but they're achieving other milestones early enough. They're able to grab, they're able to scribble, they're able to talk, but still they are crawling. Okay. That is late bloomer. The child, without any intervention, is going to achieve that particular milestone. Okay, but when you're seeing delays in multiple domains, it's not late blooming. No. The child is not talking, but the child is using gestures. Okay, the child is still going to talk. It's not late blooming. You find out that the late bloomer is, apart from that there's a delay, each day you see some improvements without intervention. But children with a true delay, Without intervention, you're not going to see improvement. Okay? And instead of confusing yourself or reassuring yourself that this is a late bloomer, it's better you come to us and we tell you, oh, let's give this child some time. If after this age, the child doesn't do this, we'll intervene. Because not everybody that comes that will start intervention immediately. So we'll just say, okay, oh, your child is a year, 4 months, is still not walking. We check the limbs, we check everywhere. Oh, everything seems fine. He's doing other things he's supposed to do. Okay, let's give this child some time. Okay, make the environment in your house conducive for movement. Okay, remove everything that could injure the child when the child is crawling. And then let the child roam. This child will pick up. Okay, but if you come and we check the child is malnourished. You have to go and feed the child well first before we start talking about intervention. If we check the child and the child is stiff, the legs are stiff, we don't have to wait till that child is 18 months before we start intervention. We'll tell you this child needs to start physiotherapy immediately.
Okay, so that too shows that the child might not walk on time.
The child might not walk. The child is just stiffing up. No, the child is not going to walk without intervention. We can actually see that stiffness even before 1 year. So we know this child is not going to walk. The child is not even going to sit without intervention. So let's start the intervention to help this child early.
Okay. I've also seen, just in line with that sitting thing, I always see in situations where you're carrying a baby even before age 1, while you're trying to put them on your lap standing, they just, just slouch. They don't. Is that also a sign to worry about?
Yes, that shows that the child is a little bit floppy.
Yes.
So that means that the tone may just be too loose, the muscle tone.
Is that some form of delay or the defect of any kind?
It may be a sign that this child will have a delay.
Oh, okay.
Okay, so when the child comes, we don't just ask you questions. We examine them, check how floppy are you, how stiff are you. So if there's some floppiness, we know this child is more likely to be delayed. But if we check and everything, we check the tone, everything is normal. Okay, we say, let's just wait it out to just be this child.
All right. Thank you so much. I'm learning. I won't stop saying this. But the last 2 episodes on this show has been quite very special for me. Situations, I recall when my baby was, I think my daughter was, that was in 2020, during the COVID. She was too active at a point. I was worried, why should a baby be? Everything was just too, like, I'm sorry, but we have to take her to the hospital because I feel like it was too much. For a baby of my age, it was just too busy. So for me, it wasn't something I would likely just want. I'm quite inquisitive. So I took her to see, a pediatrician, and then he said, what he told me was, Madam, you should be glad that your child is active. But it's not something that was okay for me because I felt like the other siblings were not like this. Why is she not very active? So apparently, I want to know that cases where children are overly active, is it a disorder at some point? Is it something that a delay would cause? That is me thinking in my, layman term. But talk to us as a specialist now.
Thank you for that question. It depends on the age of the child.
Okay.
Okay. If we see an infant less than 12 months being active, of course we are happy.
Okay.
That's what you're supposed to do. You're supposed to stress your parents out. That is all part of development. You're supposed to explore.
People were just too much.
You're just supposed to explore your world. Okay. Remember, you have multiple children, they are not the same. Maybe your baby wasn't even really too active, but you were comparing her to her more laid-back sibling. Okay, there's a whole wide variation of what is normal. It's normal for an infant to go tear your books. You keep your books, they tear it. You keep your passports, they tear it. You keep important documents, they tear it. It's part of exploring their world. It's part of developing their fine activity, their growth. It's all part of it. It's even part of the social development, because when they tear it, they are going to look at your face to know what is this one going to do. At least by the time you frown, oh, this makes mom angry. This is not really very acceptable. Okay, so a child less than 1 being active is okay. Okay, but when that child has passed 4 years, we expect this child to understand some social cues. Okay, you don't just come out in the public and start behaving anyhow. Okay, you should be able to stay still for some time. Okay, so when we see a child who is 4 years and above, you come into a place that you don't know and you start destroying things. That is a feature of an issue, a neurological issue.
Oh, okay.
Are we dealing with some hyperactivity disorder?
Oh, that's another name there.
Okay, are we dealing with some hyperactivity disorder? But if it's a child that is less than 4, this is a child who is still exploring the world. Okay,
That's
so it's too
acceptable.
early to label that this child has an issue. But for an older child who should have acquired that social milestone of knowing when to sit and when to do things, and you're still not doing it, that is an issue.
Okay. The next question would be, I mean, you see children on a daily. So what are the most common, delay cases that you see that you feel like, oh, there has to be some level of attention drawn to this time in terms of creating awareness?
Yes, the commonest we see is developed in all the domains. We call it the global developmental delays. Okay, and most cases has to do with the issues that happened around birth. It's 21st century, for crying out loud. But women are still delivering in their homes.
Okay.
Women are still delivering in unorthodox places. In this 21st century, in Enugu, that is not right. And when complications happen at birth, the person who is taking the delivery is not skilled enough to handle that. So by the time they even come in, apart from that they are not skilled enough, they deliver a child who has complications, instead of referring the child immediately to the pediatricians, to the neonatologist to take care of that child and see what could be done to remedy the damage that has been done. They keep the child back at home. They only refer when the child starts convulsing, which is already too late. Some damage has happened in that brain already. Okay, that is the commonest one we see. Okay, another one we see is children who are having challenges in their motor domain, the gross motor domain. They are not walking. You see children who are 2 years, they are not yet holding their neck. They can't hold up the head. You carry them, they just slouch back. And they are coming after 2 years.
True.
In this age and time of information, coming so late. Because maybe somebody has told them, don't worry, the child will outgrow it. My child was that way and then the child outgrows it.
Yes,
no,
there's always that comparison.
It should come early enough. It's better they come and we tell you, okay, madam, we'll see you again in 3 months before we start intervention. Let's see what's going to happen. Another common one we see is delay in language. Okay, we discussed the other time about autism. Autism causes that delay in speech and language and is becoming a bit commoner. So we see that quite a lot.
Okay. I mean, we will take one last break, and once we will come back, we'll just, wrap up the show. You're still watching Gyna Plus on Afia TV, and we're discussing developmental delays in children. And there's a lot of information, going out. So if you have missed so far, you can catch up on our YouTube channel, Afia Culture and Lifestyle. I mean, it's going to be there permanently, by the grace of God, so if nothing goes wrong. But then again, I still have Dr. Ngozi Onu in the studio, but we'll be back after the break. Please stay tuned. Welcome back. If you just joined us, this is Gyna Plus on Afia TV, and we're discussing developmental delays in children. And I still do have Dr. Ngozi Onu, who is a pediatric neurologist, Enugu State University Teaching Hospital, doing an amazing job right here. Thank you so much so far. And as we wrap up this session, I have one question to just, wrap up. While you've talked about all of these delays, the causes, what parents should do, in an event where they do all of these things, the reverse always the case.
Sorry, I didn't get that.
Is there always a reverse in all of the cases? Like, have you ever seen children you handled, and because they come on time, they do the manage the preventive routines and
definitely. Okay, we've had children who were really very bad, and then by the time you're seeing them at age 3, 4, they've done so well. Okay. And the key difference is the time at which the intervention was started, and then the commitment of the caregivers. Okay, early intervention is key to all neurological issues in children. A child who is delayed, instead of waiting till this child is too old and all the muscles are stiffened up, if you come early enough in the infantile period, we start physiotherapy if it's a gross motor issues. We start speech therapy early if it's issues with the speech and language. You find out that this child will still meet the milestones. We don't wait for the delay to happen. We find out this child will still meet the milestones, maybe some months later than is expected for his peers. Okay, so early intervention and consistency Most times the parents just come once, especially for the physiotherapy is supposed to be done at least 2 to 3 times weekly. They're supposed to present the child with the motor delay, okay, for physiotherapy 2 to 3 times weekly. But you see them, they come once, I'm going to work, I have business, my daughter this one, the other
And
one,
they
and they don't come. And the ones we came, we didn't see any response. The response is not gotten on the first instance. It's something that has to happen over time. Apart from the therapy that is done in the hospital, okay, the parents are also advised to go home and continue those therapies the much they could do at home. So if the parents are consistent and if they present on time, we see improvement over time.
All right. I mean, thank you so much. But one last thing I'd like you to address is, when you talked about delay in movement, in walk, with some children not walking on time, you talked about the stiffness thing and the rest. So there's a common practice. I don't know how common it is in Enugu, but in some part of the world where I've seen, they get to dig the ground, put the baby inside, bury the child's, like from the waistline down, they bury the child in the soil and then leave the head up, and then they should be there. And that's how they will learn to walk because of that practice.
That is child abuse.
I'm not laughing. The way it came out.
That is child abuse. Anywhere you see them doing that, they should be reported. Why should they abuse a child?
Okay, because they feel that would make them walk faster. That's the mindset behind it. So
there's no scientific evidence that is going to make the child walk faster. Rather, it's going to traumatize the child. Can imagine where you're buried and only your head. You can imagine how scared you're going to be.
All right. I mean,
it's traumatic for the child. It should be discouraged. Nobody should do that.
And that's not a solution.
It's not a solution at all. If your child is not developing as it's supposed to, bring the child to the experts. Let the experts guide you on what can be done to help the child. Don't go traumatizing the next generation.
All right. Thank you so much. Thank you. I mean, it's been a good time having you on Gyna Plus. Thank you. We've been talking to Dr. Ngozi Onu, pediatric neurologist, Enugu State University Teaching Hospital. And I personally have learned so much on the show. From last time she came, we talked about autism, and now we talked about developmental delays in children. This is one episode, or rather 2, that you should not miss. Check it out. Share the information with your loved ones, your friends, so we don't keep spreading wrong information. My name is Doris Mayum Shishe. Thank you for watching. Have a lovely evening.